Hello friends, how are you? Welcome to my channel. Today's video is about anesthesia practice questions. In previous video, we have discussed about anesthesia guidelines, anesthesia modifiers. In this video, we will apply those guidelines and solve some practice questions. Let's start the video. First question. An anesthesiologist begins preparing a 40-year-old patient for anesthesia at 10 am in the operating room for a hip replacement surgery. The surgery begins at 10:30 am and concludes at 12 pm. The anesthesiologist continues to provide care until the patient is safely transferred to postoperative supervision, ending anesthesia services at 12:30 pm. What is the total anesthesia time to be reported for this procedure? The question is about anesthesia time. Here the anesthesia services started at 10 am and ended at 12:30 pm. Anesthesia reporting time means whenever the anesthesiologist starts preparing the patient for anesthesia and ends at the time where the anesthesiologist transfers the patient to the post-operative supervision. So here the start time is 10 am and end time is 12:30 pm. So the answer is 2.5 hours. The next question is, a 58-year-old patient with coronary artery disease undergoes catheterization under general anesthesia. The anesthesia services are provided by an anesthesiologist who monitors the patient throughout the procedure. There are no complications during the surgery. What is the correct CPT code and modifier for the anesthesia services provided? Here we have 4 options and we have 2 different codes given in these 4 options with the modifiers given. So in the question, the anesthesia services are provided by an anesthesiologist. So for this we will append modifier AA. So we can eliminate these 2 options. As the modifier AA is not present in these options, we can eliminate these 2 options. The remaining options are 01922 and 01920. Now the CPT code will decide the answer. When we go to the CPT code, 01920 indicates cardiac catheterization including coronary angiography and ventriculography, and 01922 indicates anesthesia for non-invasive imaging or radiation therapy. So the cardiac catheterization is included in the code 01920. This is the right answer and this is the wrong answer. The answer is 01920 with modifier AA. Here is the third question. A 62-year-old patient undergoes a laparoscopic colectomy for colon cancer. The procedure is performed under general anesthesia. A CRNA administers the anesthesia under the medical direction of an anesthesiologist. The anesthesiologist is only supervising this single CRNA during the procedure. What is the correct CPT code and modifier for the anesthesia services provided by the anesthesiologist? Here we have 4 options. In these 4 options, we have the same CPT code. So the modifier is the deciding factor for choosing the correct option. Anesthesia is provided by the CRNA who is directed by the anesthesiologist. And the CPT code and modifier is asked for the anesthesiologist, not the CRNA. Here QK modifier is for medical direction of 2, 3, 4 concurrent anesthesia procedures. This is not the right answer. Here QX modifier is for CRNA service with medical direction by the physician. In the question also the CRNA is directed by the physician, but the code is asked for the anesthesiologist, not the CRNA. So this also is a wrong answer. Next, QZ modifier is for CRNA services without medical direction by the physician. Means the CRNA is working independently, which is not given in the question. So this is also a wrong answer. The modifier QY indicates medical direction of one CRNA by the anesthesiologist. So this modifier is for the anesthesiologist. So this is the correct answer. Here the answer is 00840 QY. Fourth question. A 30-year-old patient is admitted for a vaginal delivery with labor pain. An anesthesiologist administers epidural anesthesia during the delivery. While providing this anesthesia, the anesthesiologist also concurrently directing anesthesia services for 2 other procedures in different operating rooms. What is the correct CPT code and modifier for the anesthesia services provided? Here the keywords in the question are vaginal delivery, for which the CPT code should be given, and the anesthesia is provided by the anesthesiologist who is monitoring other 2 procedures. In the 4 options, we have 2 CPT codes and 4 different modifiers. Here the code 0160 represents anesthesia for vaginal delivery only. The code 01967 represents neuraxial labor anesthesia for planned vaginal delivery. So the patient is coming with labor pain. It's not a planned vaginal delivery. We can eliminate this option. Coming to these three options, the modifiers AA represents anesthesia provided by the anesthesiologist, but it does not represent the anesthesiologist is directing other two procedures. So we can eliminate this option. Next, QX modifier is for CRNA, but in question anesthesia is given by the anesthesiologist. We can eliminate this option also. QK represents the anesthesia is given by the anesthesiologist who is directing either 2, 3 or 4 concurrent anesthesia procedures. This is the right answer. So option 3 is the right answer. A 45-year-old patient is scheduled for open reduction and internal fixation of clavicle. The CRNA provides general anesthesia for the procedure without the direction of the supervision of an anesthesiologist. The surgery is straightforward with no complications arising, and the CRNA manages the anesthesia independently from start to finish. What is the CPT code and modifier for the anesthesia services provided? CRNA is directing the surgery independently. Now when we go through the options, we have same CPT code for all the 4 options. So the modifier becomes the deciding factor to choose the correct option. First option, modifier AA is for the anesthesia given by the anesthesiologist. So this is not the right answer. Here QX is for the CRNA service under the medical direction of the physician. So this is also not the correct option. Next, QZ. QZ is the CRNA service without medical direction by the physician. That means CRNA working independently, which is given in the question. So third one is the right answer. Here QK modifier is for medical direction of 2, 3 or 4 concurrent anesthesia procedures by the anesthesiologist. So here the option 3 is the right answer. Next question. A 75-year-old patient with a history of glaucoma and cataracts is scheduled for a corneal transplant in the right eye. The anesthesiologist administers general anesthesia and monitors the patient throughout the procedure. The patient is otherwise healthy and the surgery proceeds without complications. The anesthesiologist personally provides all the anesthesia services. What is the CPT code and modifier for the anesthesia services provided? When we look at the CPT codes, 00144 is for the corneal transplant. Corneal transplant present in the question, and the anesthesia administered by the anesthesiologist, which is represented by the modifier AA. Let's look at the other 3 options. Here 00145 is for the vitreoretinal surgery. So this is not the right option. The third option 00144 is the correct code, but the modifier QZ is not for the anesthesia given by the anesthesiologist. It is for the CRNA working independently. So this is also wrong option. 00142 is for lens surgery. So this is also the wrong option. So the answer is 00144 with modifier AA. So this is the right option. We have total 20 questions. We solved only 6 questions. You can go through all these questions. I will provide the link in the description. You can go to the link and practice all these 20 questions. If you find this video useful and helpful, kindly like the video and thank you for watching the video.